Hello, my name is Georgia Delgado. I am from Catholic University of Santiago de Guayaquil, and today I'm gonna talk about treatment of Fabry disease with the Pharmacologic Chaperone Migalastat. Let's start with the definition. Fabry disease. Fabry disease is a rare genetic disorder that prevents the body from making an enzyme called alpha-galactosidase A. This enzyme is responsible for breaking down a type of fat called global-triacylceramide, or better said, GB3 or GL3, into building blocks that the body cells can use. Consequence of Fabry disease. Fabry disease runs in families. It can have lots of different symptoms, including pain in the hands and feet and a specific kind of rash. When you have Fabry disease, a certain type of fatty substance builds up in your body. It narrows your blood vessels, which can hurt your skin, kidneys, heart, brain, and nervous system. Impact of Fabry disease on the heart and kidneys.
Heart disease and renal failure are both major causes of premature mortality in patients with Fabry disease. Unfortunately, this challenge is complicated further by the impact of these two morbidities on each other. Cardiac involvement is common in Fabry disease, as lysosomal storage occurs within almost all cardiac tissue, leading to progressive structural and functional changes to the heart in over half of male and a third of female patients. Cardiovascular events are the cause of death in over 50% of patients with Fabry disease. Symptoms include dyspnea, heart failure, angina, chest pain, and arrhythmia. These symptoms can be attributed to the accumulation of GB3, which triggers intracellular signaling pathways that lead to cardiac hypertrophy and fibrosis. Left ventricular hypertrophy is the most important manifestation of Fabry disease cardiomyopathy, as it leads to progressive functional impairment. Structural changes of the myocardium cause reduced myocardial contraction and reduced velocity of myocardial relaxation. Higher hemodynamic stresses in the left side of the heart results in valvular thickening and deformation. Conduction defects and repolarization changes are present predominantly in patients with left ventricular structural abnormalities. Fabry disease also affects the kidneys, as GB3 accumulates in the renal glomerulus, causing progressive deterioration of renal function and ESRD. This in turn impacts on cardiovascular risk. It is often cardiovascular complications that are the cause of death in patients with chronic kidney disease. Once reduced GFR is detected, Fabry patients are likely to already have significant cardiovascular abnormalities. Understanding these complex and interlinked disease manifestations is central to improving outcomes for patients with Fabry disease.
Applications in medicine. Treatments. There are two options available for treatment. The most common has been enzyme replacement therapy, which replaces the enzyme that is missing or not working correctly. This allows your body to break down fatty acid substances that way it should. It will also help ease the pain and other symptoms that Fabry disease causes. You will probably visit an outpatient center every few weeks to get the enzyme injected into the vein. A newer option is the oral medication Migalastat, well as known as Galafold. It differs from ERT in that it works to stabilize the enzymes which are not working. This also helps ease the effects of the disease on your organs. Therapy for Fabry disease.
We both started showing symptoms at around the age of 3 or 4, but both of us were formally diagnosed at the age of 5. We're definitely affected by having Fabry disease, even in the aspect of 3 of us have it and my mom doesn't. So it's not a negative, but it's definitely something where the 3 of us know what's going on. But, we kind of have to catch her up a little bit. And she's been such a great supporter through all of this. But it's definitely difficult, I think, especially for her, just watching all of us kind of go through semi the same thing, but also in very different ways. So she's kind of been that main supporter and caregiver through this. And, even as parents, like, especially like in terms of like mom and dad, just like watching their kids going through certain things and, just doctors not knowing, you don't want to watch anybody you love go through pain or a hard time. So it's definitely impacted us in that way, but we're definitely a lot stronger as a family. It kind of sounds cliched, but really through something like this, it's kind of almost difficult not to become closer. So we do a lot together, and they're definitely my main supporters in my life. So I'm very blessed with that. It was pretty hard, but I had my sister and my dad who also have the disease. So it was difficult mostly, but it really has built me up to be a really strong and independent person, how I am today. So it was definitely really hard when I was younger, just having to be different, like I said earlier, but I think it really worked out for the best and made me who I am today.
Pros and cons. Indications. Migalastat works by binding to active the site of the defective enzyme. This stabilizes the enzyme, enabling it to enter the lysosome. Once inside the lysosome, Migalastat dissociates from the enzyme, allowing alpha-galactoside A to catabolize the accumulated substrate. Migalastat should not be taken without 2 hours of meal, as food reduces absorption by 40%. Most of the dose is excreted unchanged in the urine with a half-life of 3 to 5 hours. Renal impairment will increase drug exposure, so Migalastat is not recommended if the glomerular filtration rate is below 30 milligrams per minute. Key facts. Migalastat.
Now moving to the next drug, Migalastat. Before going to the drug, we'll discuss something important. First of all, there is a lysosomal storage disease known as Fabry disease. Now what happens in Fabry's disease is there is deficiency or decreased functioning of an enzyme called as alpha-galactosidase. In short, it is written as GAL-A, galactosidase A or alpha-galactosidase, and this is present, the gene of this is present on X chromosome. Now what happens when this enzyme is not working properly, that lead to accumulation of globotriaosylceramide, and this is the main problem in Fabry's disease. Now coming to another important thing, the mutations which occur in the gene for this enzyme, they result in misfolding of this enzyme, this protein. So when misfolding occur, that means this cannot work properly. Okay? Normally, endogenously, there are some proteins present which help in proper folding of an enzyme or a protein so that it can work properly. And what are those proteins called? Yes, they are called chaperones. So chaperones are the proteins which help in proper folding, which result in activity of enzymes. So this is a drug which is aimed at improving the folding of this misfolded enzyme, and that will result in functioning of this enzyme. So this Migalastat can also be called as pharmacological chaperone. So this is a first kind of a new drug formed called as pharmacological chaperone. So what happens when we give Migalastat, it binds to the alpha-galactosidase which is defective, and this defective enzyme now is folded properly due to this pharmacological chaperone, and when this is folded properly, now it can result in functional enzyme. So the this GL3 which was accumulating will not accumulate and the disease will be treated. Clear? Now the most important thing, how to remember this, and from the name you can remember, Migalastat says that it will make the misfolded, MI means misfolded galactosidase A, that means alpha galactosidase static. Static means inhibit. So it will inhibit the misfolding of alpha galactosidase. So the name says it is a pharmacological chaperone. It will improve the misfolding of this.
Issue applied in Ecuador. Comparative studies. Migalastat has been compared to placebo in adults with Fabry disease. Only 22% had been treated with enzyme replacement therapy. In the double-blind trial, 28 patients took oral Migalastat every other day and 22 took placebo. After 6 months, 41% of the Migalastat group had a reduction of at least 50% in the number of GL3 inclusions in the interstitial capillaries of the kidney. This response was seen in 28% of the placebo group. Placebos and Migalastat.
Medication studies usually include a placebo, except perhaps in the very earliest phases of testing the drugs. The placebo simply means an inactive treatment that is meant to look like the real drug. The point is that there's a placebo effect, that if you give somebody a treatment for their illness because they really want to get better, they will tend to feel better. With a disease like PSP, that happens in something like 30% of people who receive an inactive treatment. So, in order to tell whether the drug that you're testing is really better than nothing, you have to divide the group of patients into an active drug group and a placebo group. So the placebo, it will look like the real drug. Typically, half or a third or a quarter of the patients in the study will be receiving placebo.
Conclusion. Statistical analysis showed that overall, Migalastat was no different from placebo. The drug was more effective in some mutations than others. So if the results are analyzed according to the mutation, there is an advantage for Migalastat. Thank you.